students, hope you're doing well. Dr. Al-Jazzi with you, and as usual, today we're going to talk about the topic of qualification. What does it take for somebody to qualify for weight loss surgery? Okay? Excess weight is not sufficient. There are other things that need to be present to qualify the individual for weight loss surgery. All right, so let's go back to the principles, the BMI. Let's discuss the BMI first. It's body mass index. So it's an index of, or it's a relationship between height and weight. There's a certain formula. And then people are put in classes, okay? So how does that work? So if the BMI, we're going to start from the bottom and go up. If the BMI is less than 25, let's say from 18 to 25, it's exactly 24.5, but let's say 25, then this is a normal BMI. If it's 25 to 30, we qualify the person as being overweight. And obviously this is normal, so we're not going to talk about this. Being overweight doesn't qualify, at least in the US, doesn't qualify people for weight loss surgery. And then higher up, we have 30 to 35. And with this BMI range, the person has obesity class 1. Then when it's 35 to 40, it's obesity class 2. Then when it's above 40, it's obesity class 3. Here in the US, these categories are the people who are candidate for weight loss surgery. Now, this category here is pretty, what's the word? It's kind of restricted, iffy. Not many procedures are allowed within this range. In other words, only certain procedures with certain criteria, to case by case. For more liberal, if we can say it that way, for more liberal use of weight loss surgery, we like to stick to those two BMIs. So, in other words, the person has to have a BMI at least 35, but that's not sufficient. So, if a person has a BMI of 35, between 35 and 40, it has to have certain criteria. So, 35 to 40. Then the person has to have at least one medical problem from the list I'm going to list right now. And that is diabetes mellitus type 2, not type 1, high blood pressure, sleep apnea, obstructive sleep apnea, and other respiratory disorders, and it's case by case obviously, but it helps tremendously. A condition called non-alcoholic fatty liver disease. In other words, it's a disease of the liver, but not from alcohol, from obesity. Then we have osteoarthritis or arthritis. Okay. Next is lipid abnormalities. In other words, the lipid profile is abnormal, and we know it's from the excess weight. Then we have some specific gastrointestinal disorders, and then heart disease. Okay, the most common are these here: diabetes, high blood pressure, sleep apnea, non-alcoholic fatty liver disease, and then heart disease. These kind of, they are very frequent, very common, and when you have one of this condition to this kind of range of BMI, it's sufficient to qualify the person for becoming a candidate for weight loss surgery. Now, if the individual has a BMI above 40, like 40 and higher, then you need none of this. It is enough to have this BMI to qualify for weight loss surgery. Okay? Last not least, so we've been talking about BMIs. We've been making the assumption that you need to have a certain range of weight or BMI to qualify for weight loss surgery. Another aspect or another criterion that needs to be brought to the attention to everybody is the fact that the person needs or must have experienced, I'll write it down here, experienced. So the person must have experienced the inability, okay, to achieve a healthy weight loss. Okay? In other words, the person must have tried losing weight before proceeding with weight loss surgery. Okay? Hope this is helpful and hope to see you soon. Take care.